Hi, everyone. Thank you for joining us today for a cardiac rehab work group. My name is Christy Degner, and I am a site engagement coordinator for MVC. I look forward to facilitating this work group for you all today. Today's cardiac rehab work group will feature a presentation by Jana Stewart, Noa Kim, and Mary Casey. Jana Stewart is the project manager for MVC. She provides project leadership for MVC's cardiac rehab and preoperative testing efforts, and is responsible for MVC's communication strategy and material development. Noa Kim is the informatics design lead for two population health CQIs, the Michigan Collaborative for Type 2 Diabetes, otherwise known as MCT2D, and Healthy Behavior Optimization for Michigan, HBOM. As part of HBOM, Noa supports partnering CQIs like the MVC BMC2 Michigan Cardiac Rehab Network in developing tools, resources, and programs to meet their goals around healthy eating, tobacco cessation, and physical activity. Mary Casey is the project manager for the Blue Cross Blue Shield of Michigan Cardiovascular Consortium, or BMC2, where she manages special projects for the PCI, vascular surgery, and MIS-HC registries. She is one of the BMC2 partners working on the Michigan Cardiac Rehab Network, otherwise known as MiCR. Thank you, Jana, Noah, and Mary for being here today. Before you begin your presentation, I do have some brief housekeeping items to review. First, this session is being recorded. The slides and the recording will be shared with all of the attendees following the work group. Next, we will be monitoring the chat throughout the presentation, so feel free to add questions there. We'll also have some designated time at the end of Jana, Noah, and Mary's presentation for unmuting if you'd like to ask your question then. And then lastly, your feedback is very important to us. If you could please complete the post-work group survey in a link that will be provided following the work group, that would be greatly appreciated. Thanks so much. With that, I will turn it over to Jana to start the presentation.
Thank you, Christy. Good afternoon, everybody. I'm glad to be here on behalf of MVC and the support team for MiCR. Really excited to announce and help launch our new multi-component intervention, which is co-led by our two teams, HBOM and MiCR, titled NewBeat. So today's launch is the culmination of a lot of work that took place in collaboration with our partners over the past year through meetings through the MiCR network, direct conversations with partner sites. If some of you on this call were part of that process and contributed feedback along the way, we're very grateful to you because it really helped to direct us in places that I think are going to be really valuable to folks in the coming year to support their cardiac rehab improvement efforts. Next, Christy. So ample credit is definitely owed to the HBOM team and all of their expertise, especially Noah and Laria. They have a very collaborative approach to developing these resources that was a lot of fun for our stakeholders to participate in. And going forward, these folks on the screen will be the people that you can reach out to for support in accessing the resources that we'll outline today, and then helping to refine them to fit into your own personal workflows at your sites. You'll hear from several of these teammates today, including Mary Casey with BMC2 and Noa Kim with HBOM. So to get us started, I'm going to briefly reflect on the resources developed and offered by MiCR and its partners to date, just to talk about how those efforts have fit into our vision of equitably increasing participation in cardiac rehab for all the eligible patients in Michigan. Next, Christy. So one key effort to date has been the development of benchmarking data. So many on the call are likely familiar that going back to 2019, MVC and BMC2 began distributing hospital-level push reports that were focused on cardiac rehab utilization. Refreshed versions were shared, it depended on the year, biannually or annually. And MVC generates a version of this report for its eligible hospital members, and also creates versions that are then disseminated by BMC2, MISIC, and MST-CVS for their hospital contacts. So it's one of those push reports that's been sort of shared with multiple different folks within a given site or system, which is great because there's been a lot more collaboration around cardiac rehab in terms of cross-department communication at a given site, which I think is really valuable, especially for this particular service that has so many different transition points. Refreshed versions of this report were shared earlier this year, and they included cardiac rehab metrics for MVCs, PCI, CABG, SAVR, TAVR, AMI, and CHF episode data. The reports have helped many hospitals to benchmark their care utilization to other hospitals across the state, and they were an important foundational step for us in understanding sort of the current state of cardiac rehab use in Michigan and what we felt our goals should be for improvement. Next slide. So this is a look at the types of measures that have traditionally been included in those reports, metrics such as cardiac rehab use within 90 days of discharge. Obviously, we know that the sooner that participation happens following discharge, the better, but we've sort of set 90 days as the benchmark here. Quarterly trends in cardiac rehab use within 90 days, mean days to first CR visit, and mean number of CR visits within 1 year of discharge. Go ahead, Christy. Our next primary effort to support improvement across the state was the development of a best practices toolkit. We weren't trying to recreate the wheel here. We know there's some other great resources that already exist, especially things like the Million Hearts Change Package. But one thing that the team felt was sort of lacking in that resource is that it might say something like implement a cardiac rehab liaison program without there being sort of detailed step-by-step ideas for how to make that happen. And so this toolkit outlined a few specific strategies that were best practices, things related to referrals or liaisons, some flexible scheduling ideas, some more creative ways of offering the program, using different models of delivery. And so the toolkit was a way to sort of leverage the expertise of our network. So the MiCR advisory board, many of the individual board members drafted those pages themselves. If that was the case, their name and contact email is listed on that page. So if folks look at this toolkit, find an idea for an intervention that they are interested in implementing and are having struggles along the way, they can use that contact person's email to reach out and say, hey, we've hit a blockade. How do we deal with this? What did you try? What worked? What didn't? And I think, Christy, that we're not sharing screen anymore. I don't see the slides. But that toolkit was launched about a year ago. So we're kind of in a phase now where we're evaluating what has been useful about it, what might be missing, pages to add. So at the end of the presentation today, I'd love to hear from everyone on this call about, have you looked at the toolkit? Have you used any of its pages? Have you looked at it and not tried it because it didn't have a particular strategy you wanted to try, for example? So can you go forward, Christy? And then forward again. Okay, right here. And then the third strategy that we sort of over the past couple of years have tried was hosting events such as this, bringing people together to learn from their peers, build a support network. In addition to the MVC cardiac rehab work groups, which will be offered again in 2024, the MiCR team hosts its own meetings. So there's generally an in-person stakeholder meeting each year, as well as kind of a virtual meeting. And those are a really nice opportunity to get in a space with people who, again, are outside of that sort of typical representation of quality improvement or, data analytics. You might actually get some exercise physiologists in the room or some cardiac rehab program managers, and it's a really nice mix. So those will be continued next year as well. And the website that we'll be talking about today will have those event dates listed on it so that you can sign up for future events. Slide, please. So without further ado, I'm excited to shift gears into what's next and the establishment of New Beat to address some specific patient barriers to participation. So this effort was a collaboration again between the Healthy Behavior Optimization for Michigan team and MiCR, which is an umbrella group that was founded by MVC and BMC too. Go ahead, Christy. So the resources we've offered to date were great steps, but over a year ago, we were sort of cognizant of the fact that there are still a number of patient barriers to participation, and we could do more to help support addressing those. This is the crux of, I think, why we're all here today, why we're all attending a cardiac rehab work group. Despite our efforts, it's still heavily underutilized in our state. Fewer than 3 in 10 patients are initiating it, and even fewer, around 8%, are finishing all 36 sessions. So MiCR and HBOM have partnered to develop 3 interventions to address key barriers to initiating and completing cardiac rehab. Next slide. So the goal of the New Beat program is to offer heartfelt, pragmatic support for first-time cardiac rehab patients. New Beat offers a fresh and hopeful brand for patients, and it offers providers with a single source for standardized packaged information that's sort of ready to go for them without competing branding. Next slide. The New Beat program uses a 3-prong approach. It addresses 3 barriers to patient enrollment and participation that we identified through that sort of collaborative feedback process over the past year. One of the strategies is addressing knowledge gaps within both the patient and physician populations. We've heard a lot from people that either their patients have never heard of cardiac rehab or don't know what to do to get started. And also that even some physicians aren't familiar with its components and benefits. We heard an anecdote recently at a meeting that a physician said that they didn't refer their patient for cardiac rehab because they golf or something. And it's like, no, that's not the same thing as cardiac rehab. So there's a little bit of education that needs to happen around that. And a second strategy is leveraging the influence of that cardiovascular provider to ensure a sort of warm handoff to recovery. So there's absolutely no question for patients that cardiac rehab is important, is valuable, and is considered the next step in their care, not just sort of a nice to have optional extra. And finally, the third strategy focuses on transportation access, which is a key predictor of whether or not patients can actually get there in person in a building. We can do everything right in the book, and if they can't physically get to the session, it doesn't matter what we've tried or what we've done. So these are the 3 strategies we're sort of, or the 3 barriers we're sort of starting with. And Christy, can you go to the next slide? And the 3 strategies sort of paired to each of those barriers are outlined here. And so the sort of educational piece, a starting point that we've developed is a MiCR website where we're going to house a number of those patient and provider facing resources that we developed that can be either downloaded and adapted or sort of printed as is, and we'll get into those details later. A second is cardiac care cards, which again will be sort of highlighting the importance of that physician endorsement and creating a mechanism for that to happen in a more constructive and simpler way. And finally, transportation support via an Uber Health pilot program. Go ahead. And so now I'm going to transition to hand it off to Mary, who will go into detail highlighting the first offering, MiCR's new website and resources.
Hi, everyone. I'm Mary Casey from BMC2. Happy to be here today. I'm going to walk through some of the tabs on the website just to show you some of the resources we have available for you all for cardiac rehab QI. Next slide, Christy. Next one, I think. Thank you. So I'm going to start with the providers tab here at the top. Next slide. One more. So on this web page, on this tab on the web page, we have this middle section here in the provider section where we highlight a few key resources that will be helpful to you as you start working on your cardiac rehab quality improvement journey. And so Jana already talked about the one all the way on the left-hand side, the cardiac rehab best practices toolkit. So I won't go into that too much currently or at this on this presentation. The middle one is the Middle Hearts Cardiac Rehab Change Package. This was mentioned by Jana earlier, but just to give you a basic explanation or overview of what resources or tools are included in that change package. Next slide, please. This is a process improvement document where you have a bunch of key drivers, and the implement or the change areas are organized based on the drivers. And then it has a lot of resources that you can click on and link to. Next slide, please. So this is screenshots from the document itself. As you can see, they're organized by change concept and change areas. And then in the big section, there's all these hyperlinked tools that you can look at for inspiration or customize them for your facility, or just generally get an idea of what other sites or what other facilities around the country are doing to deal with certain challenges that are fairly universal for all facilities that are providing cardiac rehab. Next slide, please. Another resource we have linked in on the website under the provider section is the Take Heart initiative. This is a little different than the change package because this focuses more on your internal team and providing information and training for your team members to promote engagement and awareness. There is a whole training curriculum provided in the Take Heart initiative. It's fairly long and very thorough, but there's also individual modules that you can pop in if there's a specific area you or someone on your team may want to take or learn more about. There's also recordings of former webinars on very important topics like using data or getting management to buy in to all of these efforts that you're working on, and as well as just updates and announcements for this growing field of cardiac rehab. Next slide, please. One more. It goes a lot smoother when I'm the one clicking, so I apologize if it feels clunky. So moving over to the Patients tab, I'm going to show you a new tool that we've developed for finding a location near you, or finding a location for a patient, or helping a patient find a location, or just having patients come to the website use it themselves. Next slide. So here in this tab, you'll see the tool, and it's based on zip code. So you can either type in a zip code or just choose it from a drop down. You can adjust the diameter or radius in terms of miles with the number line below. And next slide. Below the map here is the top 5 closest sites. So this list here, I think the zip code is in the thumb. So you see that there aren't many options. It's like goes from 2 miles to 46 miles, but in a more populated area of the state, Metro Detroit, you would get quite a few in a 5-mile radius. And so you'd be able to look at this list and maybe go through it with the patient, or the patient could look through and see which site or facility works for them. It has the facility's name, the address, the distance from that zip code, phone number, as well as services and links to directions. So you can click that blue button saying driving directions, and that'll link you or bring you right to Google Maps, where you can type in the patient's address, or the patient can type it in and use it as they would Google Maps. You can get directions immediately, or print a map, print directions, PDF directions, however you or the patient wants to use this tool. Next slide, please. So in the About Us section, we have the events option to select. Okay, next slide. So this is the page for upcoming events, and this is the list of events for BMC2 MiCR, as well as MVC and BMC2 events that are pertaining to cardiac rehab and may be helpful for this audience. In the white block on the right-hand side, you have a list of the events. Don't advance for a second. And then where the arrow was on the left-hand side, there's a subscribe to our mailing list. So if you're not currently getting emails about this group or about our meetings, that is a way that you can go to a form. It's an online form. You can enter in your information and you will be added to our communication contact list so that you will get notifications about important meetings, or just general information about cardiac rehab and this work that we're all doing. And then where the arrow is now, subscribe to our calendar. That is, if you don't want to go through and enter in the meeting one by one, you can just subscribe to the calendar. It automatically goes in and you'll never miss a meeting. So next slide, please. Finally, the resource library, we mentioned this before, just this website is a tool for information and resources. In the resource library section, can you advance it? This is the part of the website where we're just holding all of the documents that are kind of sprinkled and linked throughout the website. They will be here in one place where you can go straight to the library. They're sorted and tagged by category. So this will have information for specific topics, as well as meetings and presentations that we've had at earlier meetings. Those slides and that information will also be linked here. You can view or download those documents and use them or reference them or send them or however you want to use that information. It's all going to be in the resource library. So next slide. And this is where I hand it over to Noah.
Thanks, Mary. Thanks so much for walking through the website. I love the animations. It really is magic putting this all together. It's taken a lot of work, and it's just one of our 3 arms of the intervention that really is addressing the heart of the matter, the knowledge gap, and these transportation barriers. So I get to talk about the next intervention that we worked on together. Next, please. Ooh, a slow reveal. So these are our resources that you can download, and you can download them starting now. And we actually have a nice partnership where we'll be able to send you an interest form at the end of this meeting where you can say, I'm interested in potentially in these resources, and we can connect you with a way to get them delivered right to your hospital, your practice. This one-pager is intended for both providers and patients to address some of those overarching questions that can be a barrier. What is cardiac rehab? Why does it matter? And how do I get started? This one-pager is really a product of all of your work. I saw Jackie Evans on the call. Many of you are part of the advisory group. We went to you, we did our sticky note, we gave you homework, we looked at what really the barriers are and how we can start to build tools that unify the experience and allow a quick way to do a referral. So you can download this on the website. And then on the next page is a cute little postcard that could be used by cardiac rehab liaisons. They are, we have the ability where you can go on the website, download it, pop in your logo, your cardiac rehab facility, contact information, a photo of your cardiac rehab liaison. And this is a kind of a personalized way for you to get a patient started, all unified with a link to additional resources from MiCR. Next slide. So those are just 2 of the 2 new tools that we have offered on the website. But we know that knowledge is just the beginning. Addressing the knowledge gap gets at one key component of barrier, but we also want to reach the heart. And the quickest way to kind of our patients' reluctance and fears and to the heart of the matter of cardiac rehab enrollment is through their connection to their cardiovascular provider. We've gotten great insights from some of the leaders of our organization, including Tom Casino, who's the co-director of HBOM. He's an interventional cardiologist. And we want to really leverage the influence that you all have or your colleagues have as cardiovascular providers. Next. We were able to talk to patients. A patient who stuck out to us, his name is Tom. He was at a Memorial Day barbecue with his family, like having a great time, and he blacked out. And 6 hours later, he had a surgery. He had a major heart attack, and his whole life was kind of turned upside down. And it's in these really critical moments that cardiovascular providers, surgeons, physicians, members of the care team have the opportunity to have life-changing conversations about long-term health. And that's something that HBOM really believes in and wants to make sure that people in these situations, providers, have the opportunity and the skills, or sorry, the kind of the tools they need to have those kind of conversations. I think in the next slide, these kind of conversations can go two ways. And I think like Jana had mentioned, with someone saying their doctor said that they go golfing or they can mow the lawn, a patient can take away the message that my doctor told me I didn't need to go to cardiac rehab. And with this next tool, we hope to kind of provide another avenue. So next, and that would be our cardiac care cards. I feel really excited about these. These are available for you all as members to get for free, to have, and to be our partner in this intervention. They were inspired by grandmas, specifically my grandma and her table of cards, and maybe your grandma or you who have holiday card wreaths. We want these to stand out from the discharge paperwork. We want to design a keepsake, something that has an encouraging and direct message directly from a cardiologist, as well as from a fellow patient who's gone through cardiac rehab. In less than 30 seconds, we want your practices to be able to provide a strong and resounding endorsement of cardiac rehab that comes straight from a trusted source, something that will have a lingering impact. Next slide, please. And we know that this approach works. There's a study that showed that participants who received a personal letter were significantly more likely to attend cardiac rehab, 86% versus 59%. Next, please. So these cards, you can see a few of them here, are meant to display. They're meant to fit in along with the ones that people get from their friends, family, church, to say, we understand what you're going through, and cardiac rehab is your next step towards health. Next slide. So if you're interested, here are kind of the steps to be our partner. We'll have that interest form at the end of this talk. We'll be able to process an order and get the cards mailed to you. And from there, you'll have the chance to really personalize it. We ask that you get a signature from a cardiovascular provider at your site. They can be signed in a stack of cards just as a batch kind of task, and have them on hand to deliver to patients while they're in the hospital. And then after a period of implementation, we'll reach out to you to participate in a brief conversation to see how things are going, to see how we might improve the design or the workflow, and to get a sense of the impact. Next slide, please. Measuring success is really important. We know that this is not your typical discharge paperwork, and we want to gather as much evidence as possible of what went well, what didn't, what we can change, what we can improve on to ensure that this is one potential intervention that could work for you. Next. So you got to see the website, and you'll see over the next quarter, year, improvements to the site, expansion. We're working on patient stories. We've done some patient interviews. We have interview data to turn into kind of the case for the patient visiting the site, why cardiac rehab matters from a patient's point of view, as well as provider-facing videos and a bit more kind of informational handouts on transportation, which I'll be able to talk about next. And we can take time for questions, or I can just move on to the next section and do questions at the end. So thank you, Christy. So this last, thanks, Jackie. Thanks for your help. Feel free to put comments if as things come up in the presentation. So for this next facet of the organization for newbie, we want to address some of the real roadblocks to cardiac rehab. We've talked about the mind, the heart, but this is really the nitty-gritty of what keeps people from signing up from attending. Next slide. We know that the barriers are complex, they're multiple, there are huge barriers that need to be addressed, issues of access and affordability, insurance copays, transportation, logistics, interpersonal factors. There's not going to be one solution that is completely going to move that needle and get us to the Million Hearts goals. And so as a program, we're taking a multi-component approach. Next, please. So our first two prongs focused on provider factors like lack of knowledge, that the strength of the endorsement from the provider, having a place where they can pull easy to use resources. And our third component is going to be transportation. Next, please. So why transportation? I think that you all probably know why. It's made very clear in the best practices guide that the transportation is a major barrier to participation and enrollment. And we've identified it as something that we can act on now. So we've also heard from patients like this Trinity patient that said, I felt a sense of hopelessness prior to starting rehab. I'd missed the intro session due to lack of transportation and had a sense of being a victim with no control over finances and no access to transportation. I almost didn't reschedule and would have never started the program. And these are some of the folks that we believe still deserve the opportunity and a kind of a new approach to addressing transportation barriers. So next slide. So what we're proposing in 2024 is a new program that provides transportation assistance that can be added to the facility's toolbox of resources for addressing a patient's transportation needs. And from this pilot, we also hope to partner with the sites to create additional informational resources to kind of facilitate sustainability and scalability of how a site could go about addressing transportation needs. Next slide, please. So with this program, we hope to align and hit on many of the steps that were recommended in the best practices guide, including drafting agreements with rideshare programs, creation of materials that will make use of rides through other assistance programs like insurances and making those more readily available, and also creating resources that inform patients about options for transportation. Next slide. We don't have an unlimited budget. We don't have the ability to cover every session for every patient, but we have something to get started and to focus on the first week of cardiac rehab. We chose the first week because we know that getting people to initiate rehab is the biggest challenge. We know that 2/3 of people never do. And pictured here is Diane Perry, who isn't here, but she leads the Domino Farms Family Medicine or cardiac rehab program in Ann Arbor. And we believe that helping folks like Diane get patients connected and get started in their first week is an important first step. And with that extra boost, we can also work with Diane and directors like her to develop additional informational resources that clarify and simplify the steps that a patient needs to take to get a ride. And it's through this collaboration that we really make a difference. So we're partnering with Uber Health, which is kind of a ubiquitous service for many folks, but Uber Health is on a mission to help improve health outcomes and the patient, caregiver, and clinician experience by helping enable better access to care and services. I can give you a look on the next slide of the Uber Health platform. For anyone who's used Uber or Lyft, their apps are very intuitive, easy to use, and the Uber Health platform is similar. You can access it from a desktop computer as a site coordinator and schedule rides in advance for patients. You can track their rides. You can batch upload a roster of patients to fill in rider information in one click. And then from the patient side, it can be as untech as possible if they need. If a patient doesn't have a cell phone, they can get automated telephone calls in ways that very much act like a taxi service. It's designed to be approachable for both the coordinator and the rider, and it is designed to be HIPAA compliant. So next slide. So for this program, we hope to provide rides, about 250 round trip rides to and from a patient's home to cardiac rehab. And we've been working with Uber Health to make this estimate given our funding, and we see it as being enough to provide rides for about 125 patients for their first week of cardiac rehab. So what our next steps are. Next slide, please. Again, our interest form, that's the one place to get started. If you've heard something today and are interested, we just would love to hear from you, your contact information, so we can follow up and really get a sense of which of these programs and tools we can help set you up with. For this particular pilot, we'll be able to identify sites from there and begin enrollment with support from Uber Health and training on how to access the platform. And from there, engagement and kind of partnership with you is really important to make this a success. We will be following up with you once you're all set up and moving with the program to do a one-on-one interview and get a sense of what impact this intervention has had for you, and try to gather as much information as possible to provide a case study as an organization on here's an instruction manual for how to implement a program like this. Next slide, please. So again, these were our three-pronged approach that we talked about today. We hope you'll explore the website, download some of the materials, reach out to us through that interest form about the cardiac care cards and your interest and kind of perspective navigating transportation services for your hospital or system. And I think next is our last slide that just has that QR code. I can put the interest form in the chat and we can start a discussion and hear from anyone here.
Wonderful. Thank you so much. I think we have one question in the chat regarding the care cards. I like the care card idea from providers. Some of our post-PCIs aren't candidates, either due to the lack of insurance coverage, amputee, etc. Do you wait to put it in their folder? We don't have any specific liaison, so wouldn't have resources to hand pick who gets the letter. Any suggestions on how to navigate?
Yeah, I think that each site will be different. This is really important information to have. I think we can probably, as on our side, come up with some best practices, but it will really be up to what works well for your hospital. If it makes sense to put it in the folder, or to kind of develop a workflow for who gets it, who doesn't, and when.
Laura, do you pre-pack the folders? Is that one of the issues? Because I wonder if you could have two piles, if there's a way to quickly make a decision when somebody's grabbing a folder, maybe they already know whether they're eligible and they can grab from the appropriate pile, if that makes sense. I don't know if that fits your scenario, but another idea that came up recently at a meeting that's sort of not a replacement for this, but a different way of doing this. One thing that's really special about the cards, like Noah said, is that they stand out from everything else. And one provider in a meeting recently suggested having stickers that are kind of affixed to the folder, and that's a little bit of an alert that, you know, there may be resources in this folder telling you how to do this and that it's really important. It might be a similar situation. I'm not sure if you want the sticker on there for everybody or not. It depends on what the sticker says, but we're looking into developing some alternatives to the cards as well that are slightly different approaches.
Yeah, we have made up folders. But yeah, we just don't have, we wouldn't always screen the patient ahead of time to know whether they are qualifying. It usually takes a day or two once we get that auto referral. So I was just trying to think about how to navigate that. I'd hate to have for someone get a card and then they
Yeah.
are like, oh, I can't go. Why not? So
Mhm.
I just was
Yeah.
curious if there were any suggestions on navigating that. So
Yeah. And actually, Laura, your question also reminded me that there was a really great session presentation recently by Devraj Sukul from BMC2 about cardiac rehab liaisons. And some of the findings in that were interesting because they kind of compared the impact of sites that had not a specific cardiac rehab liaison, but who had sort of divided up the roles of a liaison among multiple different staff members, and the impact was still very significant on participation. So give just the fact that you said you don't have a liaison, I'd like to I'll just after this meeting email you the link to those slides so that you can take a look at them in case, you know, it's a really great way to kind of advocate for the findings in the presentation. Is a great way to advocate to your leadership for why there's value of hiring a liaison or for budgeting for a liaison. But it's also has some strategies for benefiting from like what it would be like to have a liaison, but spreading it out among your existing staff. It seems to be effective either way.
okay.
So just wanted to
Great.
mention that.
Thanks.
Laura, for the folders, is there any way that patients could get materials after that initial folder is given out? Like after you've gotten the auto referral, you know for sure. Or is that like the one chance?
We will call a patient once we screen them, and if they
Okay.
don't answer, or we leave messages. If they don't answer after the third message, then we mail them a letter and just give them information.
Yeah, and I see Stephanie said that they're thinking of putting it in the patient with the patient's stent card filled out by the cath lab staff. So that's another workflow that could work.
Mhm.
Anyone have any other questions for Jana, Mary, or Noah?
I also forgot to come back to that question I asked earlier. If folks on the call are able to sort of do the reaction, raise their hand, or come off video mute or something, whether or not you've used the toolkit, or you can put it in the chat. It's just we're in a phase where we're gathering sort of feedback on it. It would be really helpful to know both if you've used it, if you haven't used it. So responses from everyone are useful, even if they're like, no, I've never seen it. That's useful information to know. And if you did use it, what pages did you kind of use?
For your responses, Jen and Ellen, that's helpful.
Yeah. I am currently looking for those links to the presentations. I think what might be helpful is we'll just include it in our follow-up email.
Yeah, I could send them to you.
That sounds great. Does anyone have any other last questions before we conclude the work group today? Thanks, Gregory. Thanks for everyone's comments in the chat. Those are helpful. So I will go ahead and share my screen again to close out the work group for today. As Jana mentioned, we will include some materials in the follow-up email for everyone. So I'm going to share my screen again. Just want to review some upcoming events that we have for MVC. Thank you, Jana, Mary, and Noah for presenting. It was a really great presentation, really informative. Thank you for taking the time out of your day to do that. And thank you everyone for joining us today. So before we conclude, I just wanted to review some January work groups. As we move into 2024, we do have a health and action work group on January 9th that is going to focus on Trinity Health's inpatient readmission risk assessment tool. And then at the end of January, we will have a sepsis work group on January 25th, and that will be presented by HMS and focus on an update on HMS's work and their new sepsis toolkit. So we hope to see you there. With that all being said, thank you everyone for joining us today. We hope that you found the presentation informative. As always, if you have any questions or any feedback, please reach out to us. And we look forward to seeing you at future events. Thanks again, everyone. Have a good day.